Hello, my name is Summer, and this is my Addictions and Substance Abuse final presentation. I chose Jenny for my case. The classification and history of alcohol addiction. Alcoholism was termed a mental illness by the AMA in 1956. In 1987 was when addiction was termed a disease. Alcohol has had multiple uses, cultural, religious practices, but also negatively used for coping mechanisms. Those with alcohol addiction often experience social rejection because they are seen as irresponsible with their drinking. Confinement in asylums usually was where people with the addiction were placed. However, it's more acceptable now to with Alcoholics Anonymous. We have more accommodating interventions focused on quality of care instead of distracting or distractions. Alcohol in Washington State. Washington State is my state. I'm trying to get licensed here. It is a TerraSoft state, a case that involved many people being harmed. Created the importance, emphasized the importance of clinicians having to protect third parties of their clients from harm. They have a professional duty to do that. There's an obligation, and the TerraSoft case, in addition to the Volk case, presented problems that hopefully clinicians will be more aware of during practice. Age of consent is between 13 and 17 years old without parental approval or by a guardian. And there's limited confidentiality until the age of majority, which is 18 in Washington State. Common treatment methods include cognitive behavioral therapy, or CBT, which helps with cognitive distortions and cognitive and behavioral distortions in relationship to alcohol. Psychoeducation teaches clients about the relationship between alcohol and these distortions, as well as healthy versus unhealthy ways to cope. Association between alcohol abuse and poor family functioning has led to family interventions. So two important ones are brief strategic family therapy. The other one is functional family therapy. Those with alcohol-related disorders are more likely to have co-occurring diagnoses, which elicits the need for collaborative care. Intersectionality and alcohol addiction. I don't think it's a surprise that communities of color experience more treatment barriers than their white counterparts. Black individuals are more likely to be alcohol dependent due to racism and stigma in recovery. However, there is no difference in general in regards to alcohol consumption. Black individuals are also more likely to relapse due to systemic barriers. Black, trans, and bisexual youth are more likely to abuse alcohol. Black men drink at a higher rate than women on average. Systemic barriers prevent Black women from finishing treatment. Older Black populations also drink at a higher rate than their white counterparts. The opioid crisis amongst high-income white folks led to a treatable diagnosis and a diagnosis of opioid use disorder, whereas the war on drugs created a horrible time for Black communities. Black communities were targeted and criminalized. That's a great example of showing who is suffering and who is not, or the perception of society. So it's very, very crucial that we remember this, are aware of it as clinicians or clinicians in training. And Black individuals are also less likely to have support. So support is very crucial. Washington State being more rural, vulnerable populations may not have access to high quality care. It's important to make sure that online interventions are just as efficient as in-person treatments, so that clients receiving online care can receive quality care. Process addictions. Process addictions, we discussed this for one of our discussion assignments. I especially want to discuss this as it allows me to talk about the differences and similarities between process addictions and substance use addictions. Genetics are significant in 40% of addictive disorders. Behaviors can cause shame, hopelessness, and self-loathing in process addictions, similarly to substance use addictions. Sex addiction was the addiction that I discussed for our discussion. So it is commonly diagnosed in those with other disorders, especially substance use disorder. It's more prevalent in individuals with childhood trauma, also more prevalent in men as well. It's important to take gender and social stigma into account, especially since men are hypersexualized and may be more likely to be diagnosed with said addiction. Loss of control can impact mental health further. So relapse very much can cause hopelessness more, and that is for process and substance use addictions. Physical signs of abstinence and withdrawal are easier to see, more commonly in substance use addictions or substance use disorders versus process addictions, which is why it may not be process addictions may not be taken as seriously as substance use addictions. All right, cultural considerations. Cultural blindness. The definition of cultural blindness is the disregard for individuals' cultural differences which help inform treatment decisions. The dominant cultural group is not usually aware of these differences, eliciting the need for counselors to educate themselves on how their culture impacts others. Religious considerations. Religious and cultural beliefs can influence individuals' moral values so they can act as protective factors against alcohol abuse. Risk of suffering from alcohol addiction for religious individuals is between 30 and 40% lower than those who do not practice religion. It's important to consider religion and culture when working with all populations, as religious and cultural beliefs are diverse and are often protective factors against addiction. It's important to remember those important factors when helping clients accommodate in interventions. The risk of suffering, sorry, my apologies. The counselor and client differences. So one difference between, I guess two differences between me and Jenny is that Jenny is a mother and a wife. So her social expectations are different from mine. Women often hide excessive drinking due to these social expectations. So because Jenny is a mother and because she's a wife and she has the roles that she plays at home, this might lead to feelings of shame and to hiding excessive drinking from her husband. All right, cultural limitations. Clients might want to work with clinicians of similar identities due to lack of trust. Good example that people of color, clients of color might want to work with clinicians of color. And studies show that there's stronger adherence to treatment plans and better treatment outcomes when this happens. It's important for clinicians to consider the most important comfort of clients and excuse me, getting over a cold. The comfort and care of the clients and who they want to be working with, as well as who they want their support to be. Discriminatory acts in the past have altered the perception regarding white people, which impacts treatment. All the more reason to stay informed and advocate for clients. Being a white person myself, awareness is crucial, and understanding and learning different cultures, different limitations, different social barriers that I may not even know of, very crucial for interventions and treatment, accommodating for our clients. A deeper understanding. Clinicians must speak to professionals, what I said before, gaining exposure, more likely to be open to cultural experiences when you are out there listening to those personal experiences, lived experiences, and immerse yourself in cultural events. And again, more exposure to cultural differences proves one's openness to cultural experiences, creating a more multiculturally competent counselor. Awareness and treatment. Right. Harm reduction programs have shown that homeless individuals with alcohol addiction initiate change when they have autonomy, support, and engagement. Exploring cultural values helps clinicians find the appropriate culture-specific intervention if need be. Having ethnic-specific connections close to home helps clients experience a sense of belonging, which enhances treatment. Acquiring a list of resources for clients such as the National Queer and Trans Therapists of Color Network prevents cultural blindness and supports their unique needs. The audit, C, and semi-structured interview. These were the assessments, or the audit C was the assessment I chose. I chose another assessment as well, which I will be discussing, as well as the semi-structured interview that I believe should be included for both assessments. So why the audit C? Jenny's case does not discuss the history of drug abuse, and Jenny also has carpal tunnel syndrome. So this questionnaire would be best paired with a semi-structured interview, as it explores the symptoms of her physical health disorder, but also she does not have a history of drug abuse, like I said, so she only requires a brief assessment. And this assessment has 3 questions: very strong validity, high retest reliability between scores of 0.75 and 1, which is considered excellent reliability. Accessibility and cost is easily accessible online and is very cost effective. Cultural considerations, it is an efficient assessment across diverse races and genders. Semi-structured interview, though, I always believe is important, especially to identify different cultural factors that clinicians may not be aware of. So because the semi-structured interview is adaptable and explores cultural values, I believe that should be used for Jenny. All right. Health workers or healthcare workers can administer the assessment, but it can also be self-administered. Scored between 0 and 12 points, and men and women between 8 and 12 points is severe. Between 6 and 7 is high, but there's a difference for moderate and low for men and women. For men, between 4 and 5 is moderate, and between 0 and 3 is low. For women, between 3 and 5 is moderate, between 0 and 2 is low. Semi-structured interview benefits. As I said, you explore cultural values, also explore stigma and social barriers for diverse populations, as well as the association between drinking and the pandemic, exploring co-occurring disorders, especially as I discussed before, process addictions, and medication use, collaborating with other professionals, especially Jenny's primary care physician, is important, crucial to understand the status on her other health disorders, as they can very much interact with her alcohol addiction. Right, Beck's depression inventory. So this was the second assessment that I chose for Jenny. It assesses potential depressive symptoms as decreased activity such as having a hobby or staying busy can contribute to health problems during confinement. I chose this inventory not because Jenny presents symptoms or significant symptoms of depression, but because depressive episodes increased more during the pandemic. I believe it's important to address any other factors, any other health factors or mental health factors that could be impacting or affecting her and influencing her excessive drinking. Administration and scoring. There are 21 items on a scale from 0 to 3. Severity is between 0 and 63, 0 being the common ups and downs of life, and 63 being severe, extreme depressive symptoms. There's also strong validity and reliability, common, efficient inventory. Right, internet gaming disorder. For one of our discussions, we talked about process addictions and assessments. For internet gaming disorder can create multiple health issues, can create musculoskeletal problems, depression, and episodes of insomnia. Differs from other addictions related to gaming and the internet. So there is social media addiction, video gaming. They do all differ. Internet gaming disorder, short form, there's strong reliability, strong convergent validity. It's difficult to associate this disorder with COVID-19 because it is a newer disorder or a newer diagnosis. There is not enough research to show an association between the two. Questions are asked within a 12-month period. Cross-cultural adaptations. There is a gender disparity. It's very much a stigma between gaming and women, and oftentimes men are associated with video or gaming really in general, and so symptoms of this disorder could be overlooked amongst women. All right, administration and scoring. Clinicians and researchers can administer this assignment or assessment. Items are scored separately, allowing clinicians to investigate the range and specificity of the addiction. It's scored between 0 and 45 points, and the cutoff score being 36. A total of 9 items, each scored on a 5-point Likert scale. The accessibility, it's easily accessible online and cost-effective. Right, the diagnosis and level of severity, alcohol use disorder. So the diagnosis I chose for Jenny is alcohol use disorder. Her alcohol consumption increased. She hid drinking from her doctor, ignored her husband's concerns, and acknowledges her drinking problem. So one of the symptoms that aligns more with the diagnostic criteria is A1, where alcohol is consumed in larger amounts than intended. Another symptom that aligns more with her behavior is criteria 9, where alcohol is used despite knowledge of its harm. It's also unclear how drinking will impact work and social life due to lockdown. Apologies. There are also no withdrawals that are mentioned in Jenny's case, which makes it a little more difficult to diagnose. So I did diagnose this as a mild form of alcohol use disorder. It's important to consider environmental, social, psychological, biological factors during the interview, which will unravel how alcohol became significant in her life. Again, severity, only two significant criteria: mild severity. In the DSM, mild severity translates to only 2 to 3 symptoms, which is what Jenny presents. Um, I do believe, though, Jenny should be assessed more frequently, not due because she does not have a history of drug abuse. However, due to the environmental problem at the time, it's important to see how those environmental changes also impact her drinking habits. All right, depressive disorders. Again, because I include a Beck's depression inventory, I wanted to at least consider a depressive disorder. Uh, Confinement during the pandemic is more likely to increase symptoms of depression. Women and unemployed individuals are at higher risk. If, however, I do not believe that Jenny is diagnosed with a depressive disorder. If she were, I believe it would be closer to persistent depressive disorder, being more likely because it's diagnosed with symptoms of major depressive disorder is not all the symptoms are filled. However, she does not experience she doesn't experience enough significant symptoms of depression, diminished she has diminished pleasure and poor concentration, as listed in her case, because she's not able to find a hobby that she can pay attention to. And these are symptoms of MDD, but they are not significant enough to claim that she has these symptoms. And she does not experience any other symptoms related to MDD or PDD. Right, the diagnostic process, it's important to establish a trusting relationship. Building trust must be prioritized. Um, it improves communication between the counselor and client. Jenny might feel more comfortable discussing these challenges related to her alcohol addiction when there is trust in the relationship. Um, After creating a relationship between counselor and client, it's important to administer the assessments. After the results are known, an interview should be placed with the results to guide the interview. It's important to ask questions about Jenny's carpal tunnel symptoms, opioid use, and its relation to alcohol. Ask how co-occurring symptoms influence addiction. Stressors such as environmental factors can lead to excessive drinking. Identifying pre-existing depressive symptoms prior to the pandemic will help inform the diagnostic process. I do think that is very important because although in the case she does not discuss having health or mental health issues prior to the pandemic, it's important to address to see if there's been any changes in symptoms in transition between pre versus post pandemic. Oh, and the thought process I had behind it was behind the diagnostic process is that the pandemic shows how alcohol abuse impacts people, how substance abuse impacts people when during uncertain times. Environmental factors, global environmental factors in this case, impacted populations and coping mechanisms during confinement showed that um, people turn to substance abuse to cope with this environment or this global pandemic. Treatment planning. Um, we discussed goals and interventions. The first goal is abstinence. Abstinence is the best goal to maintain stability. Approximately 15 to 20% of opioid-related deaths in 2016 have included other substances, including alcohol, which increases the risk of overdose. This is especially important if Jenny wants her carpal tunnel symptoms um, to decrease, because if alcohol interacts with her medication, then that will impact her physical health as well. Intense treatment will require the benefits of family support and interventions, especially if this is her first time seeking treatment. It'll be new and unfamiliar. It's important to make sure that she has support with her. Interventions, there are a few that I've listed. Significant other engagement in motivational interviewing. I think this is a very important intervention for Jenny, specifically because her son moved out of her house during the pandemic as to not get her sick, but she still lives with her husband, who is working remotely. So I think that the support system should really focus on her husband being in her life and being with her every step of the way. So this intense treatment, I think, will really require his support. Um, and and then again with that psychoeducation, um, super important to educate not only Jenny but Jenny's husband on her health and what impacts her health positively and negatively, how he can help at home. Um, it's important to keep her motivated for him to learn those motivation skills to support Jenny. Goal two, finding a hobby. Um, One significant part of Jenny's case that I believe is significant is that she wasn't able to hold, her concentration was not able to hold when she was trying to find a hobby during the pandemic, um, which makes me think that the hobby she turned to was drinking. So I think it's important to find a healthy, sober hobby um, to replace her excessive drinking habits. Solution-focused brief therapy um, might be a might be an appropriate um, intervention for Jenny. It's brief intervention, emphasizing collaboration between counselor and client to create smaller and more achievable goals over time. Techniques that are more personal and preferred by the client are used and prioritized. Change, change talk. What is change talk in this therapy? It's just that change is inevitable, that the focus is on the solution and not on the problem. Change in mental health during the pandemic and social isolation might influence individuals to drink more. So it's important to keep that motivation going, that change is inevitable, and that even during those uncertain times, that it's important to be able to find a healthy, sober hobby that makes you happy. I also found that maybe an all women's group therapy would be helpful, um, depending on the the people she talked to when she was at church or when she was helping out at church. It might be beneficial for her to be in an all women's group therapy. There are better outcomes and attendance among same gender group therapies versus mixed gender. Creates a sense of belonging and strengthens the connection she can have during recovery. Um, and I think it would also be beneficial to have both in-person and online sessions. Relapse prevention. I discussed the Washington's model of relapse prevention. I did like this one for Jenny. It does prioritize drug testing, which is appropriate for Jenny since she already has to comply with that due to her opioid use. Um, this model also focuses on remaining abstinent, learning about environmental triggers. So again, that's exploring during the interview and during recovery, those environmental factors are that could be impacting her health, impacting her behavior at home that would influence her excessive drinking. Involving family reduces substance use could possibly reduce the chance of relapse. Clients can learn mistakes from relapse, learn the symptoms, withdrawal tolerance, and how what they're able to do, where they can start to be able to control their symptoms. Relapse prevention programs are efficient, especially when clinicians check in with their clients frequently, which should happen, especially due to the 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 global pandemic. Some skills, skills, especially and I discuss it later for client-centered theory, motivational interviewing. I discussed this in regards to her relationship with her husband and including family support. Motivational interviewing helps clients understand their behavior. And Jenny provides these reasons to drink. She drinks at night and says uh, she wants to drink because it's like she's going out because she can't during the pandemic. Uh, but she needs to understand the need for change. Um, she needs to find that reason for change and strengthen it to be able to continue having that motivation to um, prevent episodes of relapse and any other further health consequences. Open-ended questions, especially during interviews, collects more personal information, which is very important to explore people's values, clients' values, to see how they can help with interventions. Clients can express themselves freely in their own words, whereas closed questions do not allow that same freedom of expression. Reflective listening communicates empathy and validates pandemic concerns. Jenny lost the activities that made her happy. So it's important to remember that and to be able to remember that second goal, and that is to find a hobby or find an activity that keeps her sober and happy, possibly even involving an activity that involves her husband as well. So there are many factors to consider um, when thinking about pandemic concerns in Jenny, excessive drinking, and what she's able to do to combat that, and protective factors, even religious factor, her religion as a protective factor, um, and what once made her happy uh, perhaps can make her happy again in online sessions. Congruence. Clinicians are um, It's another way of saying that clinicians are transparent and genuine. You maintain and strengthen trust. There's always awareness and communication. It's consistent between counselor and client. When there is no consistency between the two, there is no congruence. Theories. So what I discussed prior, I discussed theories, client-centered theory, which focuses on the relationship between counselor and client, strengthening client autonomy, communicating empathy, reflective listening, those skills that I was discussing before. Acceptance are crucial components. Counselor maintains a non-directive stance, listening to lived experiences and guiding the decision-making process. And it's increasingly used theory in addiction treatment as well. Cognitive behavioral theory, what I had discussed earlier, reveals unconscious drives and interprets client behavior. It's an empirically supported treatment. Both of these theories would be helpful for Jenny. All right, it's Brown's developmental model of recovery. I include this for Jenny, which I believe is most appropriate for her. It contains 4 stages, each containing 3 interacting components: the alcohol access, environmental interactions, and the interpretation of the self. Drinking, the focus is on control and recognizing the negative impact of excessive drinking. Motivational interviewing, that skill I discussed before, it's a crucial skill to have during this time with her husband. The transition stage, clients are more hypervigilant about their drinking. Ways of thinking about the relationship with alcohol changes. The early recovery stage item, that's when clients identify as someone in recovery and needing help. Focuses on sober life, forming relationships with those in recovery and outside. Ongoing recovery stage focuses on helping others in recovery and continue meetings and strengthen relationships within recovery. Duration and dual diagnosis. Duration, more people were admitted for substance abuse during the pandemic. More frequent check-ins throughout the pandemic might mitigate further harm, but it does depend on the unique needs of the client. It's important to address the duration of opioid use and frequency of carpal tunnel syndrome symptoms in Jenny's case. And in this case, that's why it's very important to collaborate with other health professionals or healthcare professionals to get an idea of how long Jenny needs help for. When you have treatment, right now, I would say is appropriate for Jenny. It helps identify those stressors, especially stressors due to the pandemic, if there are any. Dual diagnosis issues. An opioid use addiction must not be assumed. Although I said that prior, clients must be taught how to recognize withdrawal symptoms and especially due to opioid use, just in case there's an interaction between alcohol abuse and opioid use, as that risk, again, is higher for overdose and negative health consequences. All right, assessment and treatment. Jenny will receive level 1 outpatient treatment involving education and group therapy so that she can notice how alcohol abuse impacts others. Outpatient treatment accommodates employed clients, and clients can attend sessions from home. Psychoeducation can be therapeutic in and of itself. It doesn't need to be paired with another intervention, although it is most definitely recommended. Clients can have a better understanding of their health and symptoms. Addressing Jenny's medication use for her carpal tunnel symptoms help her understand how alcohol and opioids can conflict with one another. Approximately 80% of those who died in 2016 due to opioid overdose also used other drugs and alcohol. Anxiety has increased since the start of the pandemic, in addition to other negative mental health symptoms. perhaps changes Jenny has experienced throughout the pandemic. Um, oh, and influence her to drink as a coping mechanism. The focus is on preventative measures and protective factors for Jenny. Initiating treatment. Having family involved in individual counseling to support Jenny would increase the likeliness of her initiating treatment. Strong interpersonal relationships enhance the prognosis of Jenny's addiction. So again, having her husband involved, and although her son does not live with her, maintaining contact with him, uh, having support from him. When Jenny is ready, resources local to her must be provided. Otherwise, individual care must be continued. It's common for stressors to trigger excessive drinking. So Jenny's stressors should be explored. All of Jenny's clinicians must discuss her multiple health issues, um, collaborate to to collaborate about assessment and treatment options. More positive outcomes are reported from those who receive collaborative care compared to non-collaborative care, which is important considering that she has multiple health issues and different kinds of health issues. Results are discussed so that Jenny can understand what options are available to her. All right, and ruling out diagnoses. I discussed all the reasons before, um, but a significant reason was for my diagnosis of AUD is and not depressive disorder or any other disorder, um, is because she has no history of drug abuse before the pandemic. Um, and this shows how strong of an influential of a factor the pandemic had on many individuals at the time and still currently, um, how things have changed. And for Jenny, um, excessive drinking may have just been something that she had turned to. Unfortunately, though, she she requires that help during these uncertain times, but she can receive that help by having support from her family, accommodations, or interventions and treatment. It's important to consider everything I've discussed so far um, for Jenny to help Jenny receive the best high quality of care. I also didn't consider intensive outpatient care because she doesn't have a history of drug abuse. It's more appropriate for those, again, have a history of relapsing and require more intensive treatment. Um, Jenny will be assessed frequently throughout treatment by clinicians to identify if more intense treatment is needed. Again, at the time, it's uncertain and didn't know when the pandemic or isolation or lockdown would end. So it's important to keep assessing her frequently to make sure um, that she's heard and that she's receiving the best care possible. Thank you.